I'm Scott Lawrence Richards. My wife was Lawrence, I was Richards. We were married about 20, I better get this straight, about 26 years ago. I'm 51 years old. I teach secondary English at Cedar Falls High School. We've lived in Cedar Falls for 16 years now. I have 3 boys, 2 of them in college, 1 of them in junior high. I come from a family with a history of heart disease, cardiac conditions. Both of my grandfathers and my own father died of heart disease. Prior to going to the Mayo, I lived a pretty active life. I was able to run marathons, I rode bike regularly, I walked, I cross-country skied, very active in my life. In my late 40s, I started experiencing some cardiac difficulties. I had a single bypass done at Allen Hospital in Waterloo. That worked well, but shortly after that, I started experiencing angina again, and it was at that time that I went to the Mayo for the first time. They placed a stent where the original occlusion was, and that held well for 2.5 years. I was on a regimen of medication which lowered my cholesterol, which regulated my heart, my blood pressure, and things seemed to be going swimmingly until, again, I started experiencing angina. That predicated my second trip to the Mayo, where it was necessary to place a stent within the stent. Following that, I feel great. It's just that simple. It was successful. I've been able to do whatever I want to do. I can ride my bike 50 miles. I lift weights 2 or 3 times a week. I walk regularly, ride my bike, like I said. I have really no barriers to what I would call everyday life. I was impressed with Mayo. I'm used to receiving pretty good care. In fact, ideally, I would receive all of my medical care locally, and they can provide me with good care here. But they're also, and this is not to take anything away from the doctors locally, because I think that they're fine physicians. I think that they're caring medical professionals. I think they're very competent. They're competent enough to know when to send me to see the specialists. Dr. McAdam, like I said, I was impressed with his, not only his professionalism, but his congeniality. Normally I kind of think of the doctors at the Mayo as being kind of high-powered professionals who need to move on to the next patient, etc. He was more than willing to take the time to answer any of my questions, my wife's questions, and spent what I considered a considerable amount of time with us, being very specific about details in terms of diet, medications, procedures. My most recent visit at the Mayo, I think probably was, in a sense, more of the same, which is a good thing, and that is that nobody hesitated to bring in a specialist if they wanted to get a second opinion, or if they wanted to do a more detailed opinion of something with which they weren't necessarily specialists. The entire staff at the Mayo, I'd say that in a lot of ways it's a kind of holistic experience, which creates my comfort and my trust in Mayo. The procedures, certainly I expect world-class procedures at the Mayo. I expect world-class doctors. What I find is a clean environment. I find an a la carte menu, which was just positively delightful. The people able to give me simple directions on which bus to take, where to get off, what's the best place to go out for a beer afterwards, anything like that. The Mayo Clinic, I think, I appreciate its candor, and that is, these are the things we can do for you. These are the things you're going to have to do for yourself. And I've had to become largely a vegetarian. I had doctors at the Mayo who weren't afraid to tell me that that's what I had to do.